Evaluation and management encoding. Okay. 2025 Guide to Evaluation and Management EM Coding and Billing. The Evaluation and Management EM Coding system is used by healthcare providers to report and bill for services that involve patient evaluation and management. EM coding plays a critical role in ensuring accurate reimbursement, improving compliance, and maintaining financial integrity for healthcare organizations. In 2025, the American Medical Association AMA and Centers for Medicare and Medicaid Services CMS have refined several aspects of EM coding to align with the evolving healthcare landscape, simplifying certain processes while making others more precise. Overview of EM codes. EM codes fall under CPT codes current procedural terminology and are used to describe the level of service provided during patient encounters. They are categorized by different factors such as patient type NUVIS, established setting of care office, hospital, or inpatient settings complexity of the encounter based on history, examination, and decision making MDM. The key changes for 2020 5. Focus on simplifying the coding structure for evaluation and management services, primarily by relying more on medical decision making MDM than the previous system, which emphasized time and the extent of history and examination. Key evaluation and management EM coding changes for 2025. The 2025 changes to EM coding bring more clarity to how healthcare providers should document and report their services. Here is a breakdown of the important updates. Medical decision making MDM becomes the primary criterion. MDM now serves as the primary determinant for selecting the appropriate EM level. This means that time and the extent of the history examination are still relevant, but they are no longer the defining factors. In many cases, MDM will now determine the level of service. Level 1 99,000. 202 minimal straightforward MDM level 2 99,000. 203 low MDM level 390 9,000. 204 moderate MDM level 499,000. 205 high MDM. History and exam requirements. For 2025, there is a shift from the detailed history and examination requirements to a more streamlined process. The focus is on whether the patient's condition has a direct impact on the clinical decision making process rather than length or depth of history taking in physical exam. History should be documented according to clinical necessity, but more emphasis is on medical decision making. Comprehensive exams may be performed for complex cases, but they are no longer mandatory for certain levels of coding. Updated MDM scoring system. The MDM scoring system is now based on number and complexity of problems addressed, amount and complexity of data reviewed, risk of complications, morbidity, or mortality associated with the patient's condition. The level of MDM determines the appropriate AM code. MDM scoring aligns the code with the complexity of the provider's decision making process. Evaluation and Management EM Coding Guidelines for 2025. In order to select the correct EM code, medical providers must assess the encounter based on the following key components: patient history, presenting problem, simple, self limited, conditions or complex, long standing health concerns, past, family, and social history. PFS. Each the degree of complexity, if relevant, will affect coding. Review of systems. ROS must align with clinical context. 2. Physical examination based on the patient's symptoms and complaint. Detailed exams may be needed for more complicated issues. 3. Medical decision making MDM major element in determining EM level based on diagnosis complexity and decision making factors. Considerations for diagnostic tests, patient referrals, and treatment options. EM codes for office visits 99,000, 202 99,000, 215 new patient 99,000. 201 minus 90. 9,205 for initial visits with a patient who has never been seen before. Established patient 90. 9,211 minus 99,000. 215 for follow up visits where the patient has been seen in the last 3 years. Tips for accurate evaluation and management encoding. Here are some essential tips for coding EAM services accurately in 2020. 5. Prioritize MDM over history examination instead of focusing solely on the time spent with the patient or the details of the examination. Carefully document the complexity of the decision making process, which is the key to selecting the correct level. Utilize technology to track MDM, leverage electronic health records, HR, and billing software to track MDM elements. Many systems now have automated tools that help determine the correct code based on your documentation, improving both efficiency and accuracy. Be aware of updated definitions. The definitions of the components of MDM can change year to year, so always review the most recent CPT guidelines. Ensuring the correct interpretation of these definitions is essential to avoid misreporting. Ensure consistency in documentation. Consistency across the medical record is crucial. Each component, such as the history exam and medical decision making, should align with one another and support the level of EAM service being claimed. Use code modifiers appropriately. Modifiers can adjust your claims based on unique circumstances of the encounter. Ensure modifiers are used according to the rules of CMS and the payer to avoid denied claims. EM billing best practices. Proper EM billing practices are essential for healthcare practices to maximize revenue and minimize audit risk. Here are some of the best practices for EM billing in 2020. 5. Proper documentation. Always ensure that documentation reflects the complexity of care and is sufficient to support the level of service reported. This can help prevent audits and claims denials. Understand payer guidelines. Medicare, Medicaid, and private insurers may have varying rules and expectations for EM codes, so be sure to check payer specific requirements. Review and correct coding before submission. Double check codes for accuracy before submission. Claims audits often find that billing errors are due to simple mistakes, such as incorrect code selection or failing to document properly. Follow up on claims. Ensure that submitted claims are followed upon promptly and that any discrepancies are resolved in a timely manner. Stay current with revisions. EM codes are updated regularly. Stay current with annual revisions to CPT codes and CMS regulations to remain compliant. Visual aids for evaluation and management. EM coding. Here are some helpful visual aids for understanding EM coding for 2020. 5 MDM scoring levels. Level 1 MDM minimal, level 2 MDM low, level 3 MDM moderate, level 4 MDM moderate to high, level 5 MDM high. Code selection guide for office visits. Code selection guide for office visits: 99,202, 99,205 for new patients, 99,211, 99,215 for established patients. A simple comparison chart for new established patient visits, new patient 99,211, minimal 99,202, low complexity 99,203, moderate 99,000. 204, high complexity 99,000. 205, highest complexity established patient 99,000. 212, low 99,000. 213, moderate 99,000. 214, high 99,000. 215, highest. Effective EM coding and billing are vital to ensuring the accurate compensation of healthcare services in 2025. By understanding the updates, particularly the shift to medical decision making MDM as the primary determinant, and applying best practices for documentation and coding, healthcare providers can ensure compliance and efficiency. Healthcare organizations should regularly train their staff, stay up to date with coding guidelines, and maintain a consistent focus on accuracy to navigate the complexities of EM coding in 2025. Thank you so much watching my video.